All right, welcome back. This is the step where we uncover the implants that you already had received before and allowed enough time for them to integrate with the bone. So let's go ahead and start. I want you to understand this step before we start and understand the implication of how we assess for implant integration and health prior to doing anything. So, to get started, the goal of this therapy is to be able to replace a missing tooth with an implant that hopefully will integrate within the bone. And once it's integrated, then will be able to give you teeth on top of these implants. So, in general, there is a success rate of 95% of dental implants, meaning 1 out of 20 patients will probably present with a problem where the implant did not integrate, did not survive the implantation, the bone did not fuse around the implant, or the bone got lost around the implant. And I'm going to go over all of these prior to explaining to you what the next step would look like. So let's look at an ideal healing situation where the implant has fused with the bone and it had become one with the bone. So it's sturdy enough for us to go ahead and start fabricating the crown on top of the implant. For us to start any of this second stage procedure, we have to take an x-ray to assess the level and the quality of bone around the implant. So this is an ideal healing situation, and the way it looks on the x-ray should look like this. Bone should be surrounding the implant and not being lost or not losing integration with the implant. Ultimately, in cases like these, where you can see that the implant is very well seated into the bone and it's surrounded by enough bone, the final diagnosis is really surgical, meaning that even when we see a case like this, where it looks pretty much that the implant is surrounded by healthy bone, the final diagnosis is during surgery. Because in my experience, I have seen that sometimes the bone shows good quality around the implant, but it had not integrated with the implant, which means that the implant is not one with the bone, which means that the implant is not stable inside the bone. And at times it has to be removed. And one patient out of 20, even though the bone looks fine on the x ray, still clinically, surgically, that implant has not integrated, in which case I will explain to you what to do next if that takes place. But in general, if that is integrated properly, if the implant is solid within the bone, then the next step will involve step number 3 on this diagram, which means that we need to open up the gum tissue surgically. So you're going to receive a local anesthetic in the area. We're going to open up the gum tissue surgically, and we're going to place a small piece called healing abutment, which is essentially a healing piece that we place in the area for 2 weeks until the gum heals around that piece. And now you qualify for step number 4, which will involve fabricating the tooth on top of the implant. That step, which is step 3, is where you stand at the moment if the implant has integrated within the bone. Let's imagine if the healing is not ideal. In some patients, the healing is not ideal, where the implant can not integrate within the bone, or the bone can heal around the implant, but bone loss occurs during the healing process where some of the threads of the implant or a portion of the implant is not integrated or has not enough bone around it. This happens sometimes for many reasons, but when this happens, the implant may require further treatment. The way we see this on x rays is actual radiographic bone loss around the implant, and we usually count the number of threads to which the bone has not integrated and decide from there what type of therapy the patient may or may not need for us to proceed with the next step, which is giving the patient the dental tooth that goes on top of the dental implants. Sometimes the further treatment that the patient may require could be surgical treatment, surgical debridement of the threads, laser therapy around the threads, grafting around the threads. All of these are therapies that we use to try and correct for the lack of ability of the patient's bone to integrate or to fuse with the implant and try to build the bone back again. At times, this may not be possible for one reason or another. That's why a conversation has to take place to explain to you exactly what the situation is and whether a treatment is required or not. And if the treatment is required, what the timeline for healing is, what you should know or expect once the therapy is performed. And at times, and as I told you, 1 out of 20 patients may incur a complication of healing where his or her bone did not heal properly around the implant, which leads to failure of the implant to integrate. This can happen for many reasons. Patients who have a history of diabetes can be at higher risk of implant failure, even though sometimes their A1C is actually within a normal range, but the fluctuations throughout the day of their glucose over the period of healing time may not allow the proper environment for the implant to integrate with the bone, and they end up with a loss of implant. Another reason why failure of implants occurs is when patients are smokers. When that takes place, smoking, nicotine, and all of the other harmful chemicals do not allow proper bone metabolism and proper bone healing, which means that patients are at higher risk of infection around the implants, but also higher risk of lack of bone integration around the implants. And this ultimately, if that takes place, then the implant will not be integrated, and then the patient may not even qualify for future dental implants if there is residual bone to be utilized for that dental implant. Other really reasons, main reasons for lack of integration is generally bacteria around the area or systemic inflammation. When the patient has tremendous amount of inflammation or even a low grade inflammation within the body, that exacerbated inflammatory response makes it such that the bone cells that are supposed to migrate around the implant and build bone are not given enough chance to actually go and build the bone around the implant, in which case the implant may actually fail. Now, if the implants fail, we have to take the implant out. So, in general, if the implants are failed, it's a rather easy or not very complicated procedure to take the implant out. And if we take the implant out, we have to assess whether or not you qualify for an additional bone grafting in the area so that potentially in the future you may qualify for a new implant. In some cases, rare cases, you do not qualify for a dental implant in the future. Again, if your diabetes is uncontrolled, if you continue to smoke, if you have systemic inflammation, or if you are prone to implant loss. Patients who have a history of implant loss actually are at a higher risk of implant failure in the future, even though their bone may support a new implant, but that implant now is at a higher risk of loss a second time around. So then you make your own decision with after conversation with me as to whether or not you want to run the risk of doing a second implant in an area that has already incurred implant loss. And that is a decision we make together to try really and make sure that you understand that if you have implant loss, and even if your bone is sturdy enough and you have enough volume and quality of it to receive a new dental implant, it may or may not be to your advantage to receive a second implant, because that second implant carries also another risk of a higher risk for that matter of failure. So let's move ahead to again reminding you that dental implants have a 95% success rate, which means that 19 out of 20 patients will not have any issue with their implant, in which case, really, the procedure is fairly simple. We have to open the gum tissue under local anesthesia, and then we have to place this small piece of metal called healing abutment in the area, and it will look like this during 2 weeks of time. It has to remain in there for 2 weeks, after which you will qualify for essentially the next step, which is fabricating the crown. In the meantime, while you have that small piece of metal, that piece of metal has to be high enough above the gum tissue so that the gum tissue doesn't cover it. Because if the gum tissue covers it, then we have to trim the gum tissue under local anesthesia again a second time and wait 2 additional weeks for the gum tissue to heal. But the issue with giving you a healing abutment that's tall enough for the gum tissue to stay below it, the issue with that is that if you're wearing a dental prosthesis to replace that missing tooth in the meantime, that dental prosthesis will not be able to sit properly because it's bumping against the healing abutment. So you see, the conundrum is that the healing abutment is required to be tall enough so that the gum tissue doesn't cover it. But if you're wearing something in that area in the meantime, that piece of flipper or that tooth, that artificial tooth that you're wearing, will be bumping against the healing abutment and will be uncomfortable to wear and will not be necessarily aesthetic, and it may not even fit very well because there is a healing abutment underneath. So it will change a little bit the way you wear your flipper. We'll carve it up a little bit so that it's a little bit more comfortable, but I always recommend that even if we carve it to accommodate for the space that now the healing abutment is utilizing, you may have to adjust the way you wear it and wear it minimally during the healing time of 2 weeks so that the healing abutment heals well, the gum tissue heals well around that healing abutment. Now, this takes 2 weeks to heal. Once it takes 2 weeks to heal, then we go ahead and take an impression of the area, and that impression will be essentially the blueprint to fabricate your crowns that go on top of the dental implant. Expect 2 to 3 sessions to finish the crown that goes on top of the dental implant once the healing abutment has healed and the gum tissue is solid around the implant. Now, let's remember that once this takes place and now you have your crown in place, there is a very specific cleaning protocol where you have to use water pick around the implant to make sure that bacteria is dislodged and controlled for during the maintenance phase of the implant so that you don't develop implant disease. If bacteria gets around the implant, it creates inflammation and then it leads to bone loss. And if you have bone loss, then ultimately you will have implant failure down the road. Also, don't forget to floss around the implant just like you would floss around the teeth. It's very important to do it after each meal. And then don't forget to utilize the professional hygiene maintenance protocol that we have in the office. Every 3 months, you need to come for your cleaning to make sure that we're professionally cleaning the implants and the teeth so that you don't develop any gum disease around the implant and you preserve your implants for as long as possible. I hope this helps. Please, if you have any questions, ask me during the consultation and prior to surgery. And good luck, and I wish you well.